Being a good father is directly tied to being a good man. Being good to women is directly tied to being good to your children. Being a bad father is directly tied to being bad to women. Being a bad father and being bad to women are directly tied to being a homosexual man. There is a significant connection between the status of women and homosexuality. The higher the status of women in a society, the lower the rates of sexual perversions and gender identity disorders, such as homosexuality. Keep in mind that the rates of male homosexuality are higher in the Islamic world than anywhere else on earth, despite the fact that Muslim men are permitted multiple wives and female sex slaves to satisfy their lusts. One reason for this, among many others, is that Muslim boys are deprived of time and bonding with their fathers in early childhood, not only because Muslim men traditionally do not help with early child care at all, and lack of father involvement in early child care is a strong factor in the development of male homosexuality, but also because polygamist Muslim fathers are required to be with their other wives and children 50% to 75% of the time, leading to a severe lack of father bonding time for children. Children need 100% devotion from their biological fathers. Little boys being deprived of quality time, connection, bonding, affection, and contact with their biological fathers is one of the main causes of male homosexuality. A full-time biological father is necessary for the healthy psychological development of a child, and full-time father involvement is impossible in polygamy. As the Muslim woman whose own daughter became a lesbian explains, "My daughter confessed that the early trauma she had endured on the occasion of her parents' long separation had further eroded her trust in men. I knew that she was speaking of the time my husband had tried to take a second wife, how I had tried to shield my children from the trauma. What folly. As a parent, I know now that it is preposterous to believe that even minor parental conflict does not interfere with the emotional well-being of a child. Hearing my daughter say that these actions had increased her mental pain, allowing abnormal thoughts to creep into her consciousness, caused me more anguish than any previous agony I have known. I had a moment of renewed anger at my husband, remembering the distress he had brought upon our 3 children. This event had pierced the safety of the cocoon in which my children dwelled. Her daughter also revealed that lesbian pornography further influenced her development of homosexuality. My daughter confided that she had not known women could love women and men could love men. Such a possibility had never entered her mind until the day her girlfriend showed her some magazines she had taken from her father's study. The magazines had displayed photograph after photograph of beautiful women in acts of female love. Her daughter's lesbian lover had a father who routinely raped young virgin girls he purchased from poor families. Sex slavery and the rape of women and children is unfortunately explicitly permitted in the Quran. Her lesbian girlfriend's home life was agony for a thinking girl, and the stress and strain of her father's debauchery pushed her into inevitable teenage decline. Her daughter admitted that the trauma of witnessing him rape those girls further contributed to her development of lesbianism. The girl had made a small peephole in the study adjoining her father's bedroom. There, she and my daughter watched as her father deflowered one young virgin after another. My daughter said that the cries of those young girls had closed her mind to wanting a relationship with a man. Then my troubled daughter asked me the most difficult question of my life. "Mother, how can I ever love a man, knowing all that I know of their nature? To be a woman in this awful country, you must defile your life with the most tremendous injustices." As can be very clearly seen in the previous quotes, the staggeringly high rates of homosexuality in the Islamic world are absolute proof that people are not born homosexual. The fact that the Islamic world has the highest rates of homosexuality on earth proves without a shadow of a doubt that homosexuality is a psychological condition influenced by culture. Homosexuality is a mental condition. It is something that happens to a person. Homosexuality is not genetic. The causal relationship between psychological damage to the female psyches of mothers and their children becoming LGBT, which I just discussed, relates to the next cause of lesbianism, which is mothers being mentally ill or depressed. Another way the gender identity disorder of lesbianism often develops is if a little girl has a mother who is mentally unwell or mentally ill. This prevents a girl from forming a healthy female gender identity based on her mother, because her mother is not a psychologically healthy woman who can be a role model of healthy womanhood for her developing child. Severe depression in the mother. Studies of severely gender-disturbed girls often uncovered traumatic interruption in the early mother-daughter bond. This appears to be due, in most cases, to a severe depression in the mother. With little influence from the mother, such girls often become masculinized by the age of 3 or 4. Having a mentally ill or depressed mother is a very common occurrence in the childhoods of both girls and boys who develop gender identity disorders, such as homosexuality and transgenderism. This highlights how crucial it is for the husband to do everything he can to promote his wife's mental health. In one study of girls with gender identity disorders, nearly 77% of the mothers of these girls had histories of depression, and 100% had been depressed during their daughter's infant or toddler years, during the highly sensitive gender identity developmental period. Here, we again see the phenomenon of the mother as a weak or negative identification object. In their daughter's eyes, the mothers appeared fragile. Psychiatrist Dr. Susan Bradley and psychologist Dr. Kenneth Zucker found in their research that it was very common for girls with a depressed mother to develop gender identity disorders because the girls had difficulty in forming an emotional connection to their mothers. A girl either failed to identify with her mother or disidentified from her mother because she perceived her mother as weak, incompetent, or helpless. In fact, many of the mothers devalued their own efficacy and regarded the female gender role with disdain. These girls never had a chance to form a genuine female gender identity modeled after their mothers, because their mothers were themselves broken, suffering, and damaged women who had rejected their own femininity. In these cases, the daughter will reject modeling her gender identity after her mother and instead model it after her father. Psychoanalyst and forensic psychiatrist Dr. Theo Dorpat explains that lesbianism is often caused by a developmental arrest of a specific type in female homosexuals. This specific defect can be traced to disturbances and chronic trauma in their early childhood relationships with their mothers. The development of homosexuality in these women is linked with their failure to develop positive identifications with their mothers. Most significant for our understanding of the psychosocial causes of female homosexuality is the clinical finding that all patients failed to identify with their mothers. All of the daughters who became lesbians were incapable of forming positive identifications with their mothers. Their mothers were unable to promote their daughters' identification with their own femaleness and femininity. Another way this lack of mother-daughter female identification can take place is if a girl has a mother who is childish, immature, or infantile, which prevents a girl from developing a healthy female gender identity based on her mother, because her mother is not a psychological adult woman capable of being a role model of healthy womanhood for her developing child. Psychoanalyst and forensic psychiatrist Dr. Theo Dorpat explains that the mothers of lesbians are immature and emotionally fragile persons who hold themselves aloof from the needs of their daughters. The mothers of lesbians do not treat their daughters as whole persons, but rather as split-off parts of themselves. There is a reversal of parent and child roles in which the mothers expect to be nurtured by their own daughters. Since these mothers remain infantile, they are forced to see their husbands primarily as substitute fathers, and they cannot show their daughters how to have a healthy romantic relationship with a male. These mothers want to be treated like little girls by their husbands and be mothered by their children. They need to push their daughters aside and to forget them in the service of having their own needs fulfilled. Their needs remain infantile. Motherhood is too much for them. They want to be nurtured, to play, to avoid responsibility, all while maintaining an outward facade of adulthood. Because the mothers of lesbians have not grown up themselves, they are largely unavailable for gender identification. Another common cause of lesbianism is a girl having a mother who is a narcissist, because it prevents a girl from forming a healthy female gender identity based on her mother, because her mother is not a psychologically healthy woman who is capable of modeling healthy womanhood for her developing child. Dr. Siegel said of her lesbian patients, the daughters recalled in great detail how they had often been emotionally abandoned and how hard they had tried to please their mothers. Dr. Siegel says about the mother of one of her her lesbian patients. Her ineffectual narcissistic mother was unable to protect her or to provide a worthy role model. The part each partner played in the original mother-child dyad was reversed, preventing Delilah from establishing a firm sense of bodily integrity and sexual identification. The mothers of lesbian clients are generally immature, emotionally fragile, and aloof from the needs of their daughters. They do not treat their daughters as whole and separate persons, but rather as narcissistic extensions of themselves, and as such, their daughters are expected to fulfill the mother's own needs. As a result, these girls never develop a stable sense of either self or gender. Their mothers bind them to themselves and prevent them from forming relationships with their fathers or other men. There is an undertone of incest in their relationships with their daughters. Each of these women reversed roles with her child, expecting to be nurtured by her. At other times, even that was too complex a relationship. They simply negated the existence of separate bodies and minds and insisted on perceiving their daughters as split-off parts of their own selves. Dr. Siegel's lesbian patients both feared and hated their mothers. Peppina's dread of being hurt and destroyed by her malevolent mother became so intense that she could cope with it only by homosexual acts. Mothers of lesbians often inflict upon their daughters narcissistic injuries and an uncertain sense of self. As I have discussed in other videos, homosexuality is literally a form of dissociation from the true self, which has a permanent gender. The true self is always heterosexual and always has a biologically accurate gender identity. Yet another way lesbianism can develop is if a girl has a mother and a father who are both narcissists, which prevents a girl from forming a heterosexual female gender identity based on her parents, because narcissists cannot have healthy gender identities. And healthy gender identities in the parents are necessary in order for them to model healthy heterosexuality for their developing child. Lesbian patients fit a surprisingly predictable pattern. They all grew up in narcissistic family systems that resulted in a severe arrest in ego development. Of one of her lesbian patients, Dr. Siegel explains, her attributes were not seen as her own, but were used to shore up the narcissism of her emotionally primitive parents. Of another lesbian patient, she says, as an extension of her parents, Carla was unable to form a stable self-identity. Of the fathers of her lesbian patients, Dr. Siegel says, the fathers tried to make the girls over in their own masculine image. In these attempts, the fathers were as manipulative and unempathic as their wives. When the girls failed to enhance their father's narcissism, they were dropped, virtually forgotten for a time. They resumed importance only later, when they could be helpmates in seducing mother or in contributing to father's exhibitionism. When these little girls tried to turn to their fathers, they did not fare much better than when they tried to turn to their mothers. Preoccupied with their business deals, the men sporadically paid attention to their daughters and then appeared to forget that they were around. These fathers, when they took the time to react at all, responded to their daughters as persons who had to be made over in their own masculine image. Within the tensions of a narcissistic family system, in which the child is expected to meet the parents' expectations and never learns who she is as a separate individual, many of these women had long struggled with uncertainty and confusion in carving out their own personal identities. Growing up, they had their femininity disparaged by both parents. Daughters described their parents as horrible. The parents unconsciously tried to use their children to overcome their own deficiencies, and when they failed to do so, their daughters were set aside with chilling disregard for their developmental needs. In summary, both parents were regularly willing to sacrifice their daughters' developmental needs. It did not occur to them to view their children as anything but possessions. The ruthlessness, coldness, and narcissistic impairment discernible in the actions reported by their daughters point to narcissistic personality disorder and possible borderline personality disorder in the parents. And not surprisingly, borderline personality disorder is far more common in homosexuals than in heterosexuals. And just like with homosexuality, there is a huge link between childhood sexual abuse and borderline personality disorder. The more you understand this topic, the more you will be able to see that childhood trauma, mental illness, and LGBT orientations are all directly related. In fact, homosexuality itself is very frequently a symptom of personality disorders, nearly always narcissistic personality disorder. In fact, in the first edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM, Homosexuality was classified as a sexual deviation within the larger sociopathic personality disturbance category of personality disorders. The sexual deviation diagnosis included homosexuality, transvestism, pedophilia, fetishism, and sexual sadism. Unfortunately, each edition of the DSM has gotten further and further away from the truth.